Hello everyone. Good afternoon to all. I'm Martina here, behavioral therapist from WELL Rehabilitation Network. Today I am here to share with you about how to manage challenging behaviors of autism and ADHD kids. So when we talk about this, it will like it's a common way for challenging in those behaviors for artistic and ADHD kids. So because they are not understanding what is happening around them, and they are not communicating their needs and wants also. For example, they don't know how to communicate to ask them others like to to their needs and wants. So this leads to frustration and stress and anxious as well. So they are feel overwhelmed by what is going happening around them. So a lot of challenging behaviors are in for artistic and ADHD kids. So for example, that stemming and stereotypical behaviors, and main thing is stubbornness, the tantrums, and as well as the attention and distraction while we are giving the activities. These are those challenging behaviors that autism and ADHD kids are facing. So how we can manage those behaviors, how we can manage in home as well as the social situations. So like when we talk about the stemming and stereotypical behavior, so it's how we can support those child in a best way while they are representing the repetitive behaviors. So stemming and stereotypical behavior is also called as stemming and self-stemming. So it's a chain of pattern of repeating behaviors. So they are including, for example, physical movements such as repeating sounds, noises, etc. So not every fidget is a stem. So we need to observe the stemming and stereotypical behavior while they are expressing that emotional situation. For example, while they are feel more joy, while they are very stressed, and while they are very anxious, that time they will represent the stemming and stereotypical behavior. For example of stemming and stereotypical behavior is hand flapping, and that hand flapping will come and looking at the object and staring at the light and rocking and bouncing their body. So hair pulling, these so many of examples are representing the stemming and stereotypical behaviors of autism and ADHD kids. So like how we can manage that stemming and stereotypical behaviors in the sense like, first we need to see which stemming and stereotypical behaviors is respond to anxiety, stress, or frustration, and it's there affecting their, I mean, normal life, and they're affecting their concentration and attention to some of the things, and it's distracting others in the environment, or they are doing the self harm. We need to see these things. If these questions are yes, we need to identify the reason behind that. So how we can identify? First we can identify the triggering factor behind that. So how, why should they are behaving like this? So if they we need to, if the stemming and stereotypical behavior starts or decreases, we need to ask the question ourselves, what has changed? So we need try to eliminate the discomfort and stress. For example, the stemming and stereotypical behavior is happening because of stress, means we need to teach them this self calming techniques, I mean, which means self calming techniques we need to apply. So for example, we can give the kids to water that time, we can ask them to count 1 to 10, we can go for a walk, we can take a break. Like this way we can apply the self calming techniques to the kids while they are representing the stemming and stereotypical behavior, especially in the stressful situation. Another thing, we need to master the self control to the kids also, and self soothing behaviors also. For example, we can give the squeeze ball while they are biting their nails, and while they are peeling their skin and scratching their skin, we need to give the skills squeeze ball that time. So it will very helpful to reduce those behaviors. And we need to teach the important one is emotional regulation. Most of the kids not understanding the emotional part also, so we need to emotional regulation we need to apply that time. For example, we can give those kind of activities to understand the emotions. For example, we need to express which is angry, and which is happy, which is frustration, and which is sad. We need to tell them this is the emotion, then they ask to copy that and they will understand the emotions part also. So the thing is like these kind of things we can helpful to reduce the stemming and stereotypical behavior for the kids. And other thing is like stubbornness, tantrums, and aggression, physical aggression. These is very challenging behavior while they are in home and as well as in the outside places also. So parents as well, they are facing these challenges behavior. When talk about this tantrums and that stubbornness is coming from the unique challenges for the parents actually. So self regulation for parents as an kids emotion is placing as a skill. So what we need to do means like if we are reducing their tantrums and stubbornness in this age, they it will create a bright future for the kids also. So how we can manage these things, like the tantrums and physical aggression and stubbornness also. So always we need to watch our behavior. So for example, we have to watch our behavior as a parents, how we are behaving in front of the kids. So you try to you try to express your aggression in a peaceful way and in a productive way. If they are showing a more aggression towards the for example, if you're having any friends or colleagues, if you're trying to express your anger too much, means this child is going to copy that. So we need to always watch our behavior. Then if you're express your behavior in a sense of like peaceful ways, the child is going to follow that. So always watch your behavior in front of your kids. Then another one is like we need to understand their perspective also. So try to understand their perspective in their point of view. Okay, for example, if the child is eat others or someone, in social situation places or in school, we need to ask them, so why does he eat others? Instead of scolding them, we need to ask them why he does eat others. So try to enter the healthy ones and limit the unhealthy ones. So you have to try to enter the unhealthy distraction, and you have to limit the unhealthy ones. And the thing is like you always have to appreciate that you always try to appreciate that calm behavior. So for example, if the child is reacted well this time, you need to appreciate them. Oh, you did nicely this time, congratulations for that. So always you have to be appreciate that calm behavior. It's a reinforcement for the kids. And other one is like you always identify the triggering factor behind this behavior. And sometimes you have to help them to name emotions as well. So for example, how you will identify the triggers? If their child is showing the physical aggression or anything, you need to find, so why does he is showing like that behavior, what which thing is triggering them to do, and like which tantrums he or she is showing that time, and how the behavior is looks like. We need to see these triggering factors behind that. And sometimes the kid might not be get angry, they will be get frustrated, maybe because they are not understanding that much the emotion. We help them to name him the emotion as well. So you're not getting angry this time, you're just frustrated, like that we have to help them to naming the emotions. So another one is like set boundaries. We need to set boundaries, it's a clear point. I always used to say this point while they are showing the stubbornness and physical aggression and tantrums as well. So no means no, this concept you have to execute for the kids. So they ask to understand my parents are not going to change their opinion. Instead of I am showing the stubbornness, aggression, whatever might be, they are not going to change their they are not going to change their concern. So we need to implement strongly and effectively the no concept. When talk about the stubbornness, kids always needs, we have to come in their way. So we have to break that, so we have to make them to come in our way. So that's why I'm telling you, just execute the no means no concept for your kids. And the thing is like another one we are talking about these like incontinence, like it's not in familiar in for autistic and ADHD kids. Most of the parents will know about that one, which is like distractions and attention as well as the stemming and stereotypical behaviors. We all know about this is common. we need to see the unfamiliar also, which is like incontinence. It's also a challenging behavior for the artistic kids mainly. So they are affected actually by this. It's an incontinence means it's a lack of voluntary control of urination and defecation. So they are mostly affected because of what means they are not lacking of control of urination is not to be there. So it's exhibit that urge incontinence. Urge incontinence as well as that bowel incontinence and also functional incontinence as well as the difficulties in toileting. So why this happening? Because of it compromised sensory processing between peripheral and central nervous system. Because of this they are challenging this behavior, especially the artistic kids. So and another one is property distraction is also there. Property distraction, they will try to break the things, they try to tear the things whatever we are giving, they try to break and tear everything. They like even though their things also, other things also, because of what they are doing means they need to gain attention, or they are wants to say something to us, and as well as they want something from us, and they are expressing their feelings also that time. So one question came actually, if I want to take behavioral therapy and how it will be helpful for my kid. So if I want to take behavioral therapy, how it will be helpful for my kid. So if you are taking the behavioral therapy is an encompasses problematic behavior while we are reinforcing the positive behaviors and removing the negative ones. This is the behavioral therapy. We always focusing on the problematic behavior of a kid and we changing into the positive ones. So we need to see behavioral therapy. If you are taking the behavioral therapy for your kid, which kid is get beneficial from this behavioral therapy. So artistic kids, ADHD kids, and the neurodevelopmental disorder kids, other neurodevelopmental disorder kids, and as well the delayed milestone kids also. So how we can implement this care, how it can be useful, these behavioral therapies, how it can be useful. So we need to see in which area they are facing the problems. For example, in eye contact, level of understanding, thinking, and name calling, command following, and as well as the undesired behavior. We need to see these things first of all, in which area they are lacking, they are having the problem. Based on this we need to implement, we need to give therapies. For example, there are a lot of therapies in there. So for when we talk about the behavioral therapies, lot of therapies is there based on the difficulties. So in behavioral therapy we can give the modeling. We will use to give the modeling. For example, we can build the building blocks for the kids. See, always the kids will learn a new behavior through observation and imitation of others only. So we can implement these skills by to change their behavior also. So we can use modeling. For example, we can take building blocks. So first we need to build the blocks and ask the kid to copy that. So in this way they will learn the new behavior, and modeling is one of the behavioral therapy. And we can give the social skills training. Social skills training is very important need for the artistic and ADHD kids, because it's a form of behavioral therapy, and we are executing the skills to interact with others and engaging with others also. So for example, what we have to do means we can ask them to give handshakes while they are meeting other peoples, and we can ask them to give smile when they are greeting someone. And always we need to see while they are while we are engaging the kids to other person, they are giving the high contact during the conversation. We need to express these social skills training for the kids. It's a really helpful and important skills for the artistic and ADHD kids. And another behavioral therapy, like we can use the systematic desensitization also in that. So for example, systematic desensitization in the sense, so it's an fear provoking situation. We can process gradually this technique from least scary to most scary. For example, if the kids are having the fearful of dogs, Okay, we need to show the picture of the dog in the phone or laptop. We can ask them to touch that first, and they will gradually reduce the fear. After that, what we have to do means we have to take them to dark parks, whatever, and they will gradually started to engage with dogs. Also the reduction of fear also will come. This is not about that fearful of dogs. The kids having any fears, we can reduce the fear by applying the least scary to most scary things. This is a systematic desensitization is working for the kids while they are having the fear. So, and the another technique for behavioral therapy, it's in pre-mark principle also we can use to. Pre-mark principle, it's like we are motivating the other kids, we are motivating the other kids if they don't want to do. Okay, so in this way we can motivate the kids. You can brush your teeth, I will give you the chocolates, I will give you, I will allow you to play video games. In the sense we have to go. And if they are not just do your homework first, we can take you to outside places. This is the prima, how this is the prima principle is working. We are motivating the kids which they don't want to do the activities. So another technique is like we can use the prima principle, and we can use the thing like token economy. Token economy is also one of the behavioral therapy only. So we are reinforcing the kid by giving the token coins. So for example, if the undesirable behavior, if they while they are showing that undesirable behavior, we need to change as an desirable behavior by giving the reinforces. So their desired behavior would be nice ants, not grabbing the items. While they are showing the desirable behaviors, while we are asking them, that time we need to give the token coins to reinforce that. Okay, then we can use the timeout technique also. Okay, timeout technique, it's like an we are we are making the kid for no longer allowed to prefer items or activities. For example, if the child is playing a toy, suddenly they will hit others. I mean, whoever is sitting belong to them, they will hit others, their siblings. It's kind of the physical aggression also. We need to make them sit alone for 2 or 3 minutes. So this is the way we can implement these timeout correctly for the kids while they are showing the aggression, or while they are slapping and hitting others. So how can we address if leads to social impact? Can you share some methods to reduce those behaviors? So like the thing is, most of the parents are asking about I want to manage my kids in a social situation. He is not controlling, we can't able to control. This is social impact is the major thing for artistic and ADHD. We can at least listen to us in home, but when it comes to the socialization means they won't listen. So how we can address the social impact? We need to see the ABA, applied behavior analysis. We can implement that applied behavioral analysis there. So applied behavioral analysis is an impact of socialization. They are it that behavioral is addressing like social difficulty problems, and it assessing socialization part for the kids only. So when we are applying the applied behavioral analysis, so we always need to identify the function of the behavior. So for example, if the child is showing aggression in a public places or whatever, we need to identify the function of the behavior only. So if they are showing that aggression towards the other peoples, we need to identify how that, I mean, how that behavior serves the child, instead of seeing that. So how the behavior looks like is physical eating or anything. We need to see the function of the behavior of the kid only, how it will helpful, how we can help the kid to improve that and to reduce that behavior. So this is the main thing in social impact of applied behavioral analysis is like underlying. So another thing is we need to see the social impact. In the sense, we need to see the social impact of applied behavioral analysis means always we need to see the antecedent, behavioral, and consequence. So antecedent. So antecedents leak what is happening before the behavior. So which is triggering them. This is antecedent. And the behavior is how the behavior is looks like. So and the consequence means what is happened after the behavior, and we need to see the result of the behavior. So I will give you one example, general example. If you are feeling hungry, okay, if you are feeling hungry means it's an is it happening before the behavior. So for that we you are eating something, you are eating something means it comes under the behavior. And after that consequence, the result of the behavior means you are going to feel better. So this is the way that antecedent and behavioral and consequence will works. So I will give the example on the kids also. For example, we are making the kids to do activities. We are telling them, come, you can do this activity. That time, for antecedent, we need to give the instruction. If you did this well, we will praise, like that you will receive some rewards. So that's it, that would be the antecedent. I'm then The behavior of the kid means like they started to do the activity very perfectly and nicely. So then they will see the consequence. We can see the consequence. The result of the behavior would be they will we can reinforce them by giving their rewards. This is how we can handle the antecedent and the behavioral and the consequence. Antecedent is an instruction, and behavioral is a response of the kid, and consequence is the result of the behavior. Okay, and my kid is always pinching others. How to modify this behavior? So like pinching and aggression, it's everything, it leads to the aggression behavior. I already told you that stimming and stereotypical behaviors, oh, it comes under the repetitive behaviors of a kid. So in that time, what you will do means like you can give that, you need to give some activities that time. If they are pinching now, we need to distract them that time. So by giving the activities, we always have to reinforce the kids by giving the positive ones. Then automatically you can see that reduction of the positive, I mean negative behaviors. So why is pinching means you can give the squeeze balls to the to your kids also. So that time we are distracting them. So while he's doing the squeeze ball means he will forgot what he is doing. This is where you can implement the while your kids is pinching, mainly that stereotypical stemming behaviors while they are showing now, we need to explain them, we have to communicate them to their why they are doing and what they are doing. So for that you can give the squeeze ball. Actually, it's a nice thing to reduce that pinching. How to deal with 3 to 7 years kid who is having memory issue and low concentration. So how to deal with 3 to 7 years kid who is having memory issue and has low concentration. So obviously you have to identify that factor. I have to identify the reason behind that. So when we talk about, for example, I will give you some ADHD kids. So ADHD kids, the brain and the ADHD kids, how they will means like we have the four lobes in our brain. So frontal lobe, parietal lobe, occipital, and four lobes we have. So in for the ADHD kids, they are affecting by the frontal lobe. Frontal lobe is carrying the processing and that thinking, attention, more overly the level of understanding. Everything is carrying over by the frontal lobe only. So for the ADHD kids, they are lacking in that. So we can see the differences in that for ADHD. So obviously it's an like ADHD is a brain developmental disorder only. So for example, we need to brain and ADHD. I will give you some things. For example, the networks is there, neurotransmitters is working, as well as that their brain size will be less. So networks in the sense like brain is made up of the nerve cells only, nerve cells. So it's called a neurons. So neuron is nothing but we are transferring that they are transmitting the signals in the brain. For ADHD kids it will be different. So that's why sometimes they are not thinking, they are not concentrating, they are not paying attention to the things also, and they are not not thinking and understanding. They are without thinking, they are acting. So these networks now, they will be, that those networks will be lack. So other things, neurotransmitters also. Neurotransmitter is like transmitting the signal from one nerve cell to another. So for the ADHD kids, when we talk about the ADHD kids, they have low level of serotonin and non-norepinephrine. So these things only, these network and these neurotransmitters, low level of serotonin and non-norepinephrine, these things are making them to think less. So for this, we need to take the therapies. So based on the treatment, we can modify those. We can make them to concentrate on the things. We can make them to think very nicely like that. Like how I, ma'am, how can we reduce pattern behavior in kids? So, pattern behavioral in the sense, what we need to, I already spoke with you about the pattern behavior. Is then stemming and stereotypical behavior only. So, always just skills in following the patterns. Always you want to follow the patterns. So, we need to see the pattern behavioral, how they are behaving, the pattern behaviors. So, we need to express those things. So, how we can reduce the things, we can observe the bigger how they are behaving that time. I already told you, we need to regulate that emotional regulation of the kids. So emotional regulation of the kids, and we can implement that the thing is like after how they are understanding the emotions, we need to we need to implement those skills to the kids to reduce the pattern behavior of a kid. If again I am asking, if it is necessary to beat or torture kids the way is doing, if any kid is showing stubbornness behavior or not cooperating. So I already told about you the stubbornness. Stubbornness, it's an, we need to see the stubbornness. Actually I told you, the parents always wants to come in, the kids always wants to come in our, they always need, we have to come in our way, not in their way. So I told you, we need to implement the no means no concept there actually. So while they are showing the stubbornness, whatever might be, so we need to say no to the things. If you say s means they won't accept, their acceptance also want to be reduced. We always try to implement that no means no concept in the sense. So how we can improve the attention for the kids? So how we can improve the attention? So lot of parents are facing the attentions. So my child cannot be give the attention to the things. How we can manage those attentions? For example, attention is differ from ADHD and autistic. Attention in the sense for ADHD, there it's not just an inability to pay attention. It's not just an inability to pay attention, it's inability to control the attentions, because they are having low level of brain arousal. So that's why they are can't able to give so much of attention to the things. When we talk about the autism kids, they are facing actually, they are not giving focus to the things, because they are not if they don't want to interest to the activities, they won't give the focus to the things. So we need to see the how they are giving the attention. For example, when we talk about the artistic kids means, some of the kids they don't want to repeat the things also. So if you are giving if you are giving the interesting activities also, they don't want to repeat that. So because the repetition part is also coming, the thing in the sense like giving up behavior also is coming in there. So giving up behavior is also coming there. So we need to see the difference between how they're artistic kids paying the attention to the things or not. So how we can improve that attention means like attention we can improve, always we need to see teach them to improve the eye contact. So it's the baseline. So for eye contact, the distraction, concentration, attention, everything is coming there. So we need to teach their eye contact. For example, lot of techniques is there to improve their eye contact. I will tell you some of the techniques. You can use the things which they likes mostly. For example, if they like the watch or if they like the toys, you can use that. You have to take that things in front of their eyes and you have to move like this, and obviously they started to see how it's moving like that, and eye contact also will come. So for that we need to take that the things which they likes. So always for attention you need to you have to see that eye contact first. And we can use the model task is very important skill to apply in everything. So how we can use the model task, like I already told you, you can use the joining beats also. For example, if you are taking two beats means you can first beat along with the join the beats along with the kids. After that you can give the beats to other kid and they will started to join also that time. So this is how we can implement the moral skills also. And glow in the dark activity you can give. Always choose the dark room activities also for the kids to improve their attention level. So for example, if you can take the kid to the dark room and you can give activities there by using the flashlight that time, because the old room is full of dark, and we can able to improve their attention level, because their 100% attention is to be on their thing which we are doing, because the old room is dark. So this is the we can improve the attention skill. And uh, another one is like how we can improve the attention skill. Fingerprinting also one of the nice skill. Fingerprinting, you can use the fingerprinting. You can implement the identification of colors there also. If the kid is not knowing the identification of colors, you can implement that. You can use the fingerprinting. Ask the kid to take the paint and ask them to give the high contact that time, and in that time it will improve. Actually in that time it will improve. For their identification of colors also will improve, the eye contact will improve, the attention and concentration, everything will improve. So and you can give the shape and color sorting. Shape and color sorting in the sense like you can ask them to sort the shapes and colors. For example, if you are taking three bowls, you can give the token coins to them and ask them to put the colors. So like if you are taking a red means they have to put the red in the box and green in the box and as well as yellow in the box. In this way we can improve the attention level, because they are giving the full attention by sorting the shapes and colors. In this way also we can improve the attention level. How we can manage those challenging behaviors in social situation, especially when are in outside places. So always the question is raising here only. So outside places I'm not able to manage my kids in outside places. So for that only I told you about the ABA. In our clinic, in our live well, we are using as a behavioral therapist, we are using the ABA, applied behavior analysis mostly. It's a global standard technique. It's used by worldwide. So it's a reinforcement. Actually, it's a reinforcement, positive reinforcement by giving the rewards to the kid. Uh, when we talk about the artistic kids and ADHD kids, especially the artistic kids, have their lacking of social communication and the behavioral problems, as well as that how to talk with the others. So for that, in the AB, how we can apply means we need to see social skills, in the sense we need to see how we can engage them and interact them with others. I already told you about the social skills trainings. While they are meeting new persons, we need to ask them, go and give handshake and go and smile to them. We need to improve the social skills in this way only. And always the applied behavioral analysis is coping with daily life routine also. If the kid doesn't, most of the kids doesn't, the kids loves routine actually, but they don't know how to do also. So as by giving the therapies, we are executing how they have to brush, how they have to bath, how they have to do dressing like this. So this is the way we can improve their daily life routine also. So another things like they don't know how to communicate, they having the difficulties in communicate. By giving this applied behavior analysis, we can implement the kid to ask their needs and wants from others also. So by giving the ABA, we need to see the strength of the kid first of all. We which in which area the kid is having their strength. So we need to see that. So for example, if they are having the strength in reading and writing and whatever, by doing the activities very perfectly, we need to see the strength. After that, we need to identified in which area we need to improve for the kid. So like we have to segregate the strength of the kids and which area we need to improve also. So like by giving that applied behavior analysis, they are having their positive reinforcement is happening, and by giving the reward, we can see the positive changes in the kid, and we can see the reduction of the negative behavior also. So we can give the discrete trial training also, because some of the kids doesn't know how they don't know how to understanding, they don't know how to think, and that time we can give the discrete trial training. This is the only method to teach the kids. So it's an honest one, the principle we are improving, that we are increasing the appropriate behavior and decreasing the inappropriate behavior. So by giving the discrete trial training, so for example, the whoever the therapist or trainee, whoever giving that discrete trial training to the kids, we need to give the, for example, we can call the kid, like we can ask them, take the toy and put it on the chair. So at that time, they will take the toy and they will put it on the chair, and we can ask them go and touch the toy. So for that, we need to give 1 to 3 seconds to the kids to respond. Okay, so if they respond nicely, we need to give the appreciation. Okay, you did very nicely, congratulations. We need to reinforce the kids in this way only. Then you can see that automatically the reduction of the undesirable behavior for self talking and self harming, like that you can see automatically. So for that, we need to improve the positive things of the kids by doing and activities only. What are the early signs of autism? So autism, it starts to execute like 2 to 3 years of a kid. So they have the lack of social communication, restrictive and repetitive behaviors they have, and they have that eye contact, less number of eye contact, and they having the more stubbornness. They won't they will show the stubbornness actually while they are speaking also. Because of the stubbornness, they don't open their mouth also. So these are the main three signs of the autistic, is like social communication, loss of communication and difficulties in their communication, and restrictive and repetitive behaviors they have. How to make 2.8 years old kid to follow command? So for command following, what we have to do means, we need to express, we need to execute more activities for the kids. So we need to choose the interesting activities, we have to go in the interesting activities wise only. For example, if the kids is having the interest for pick and drop means, we can give, we can throw the pick, whatever the things, coins and things, we can put it on the floor. That time we have to give the comments, we need to give the multiple comments. So if the kid having the, before itself they are having lacking in the comment following means, we need to give multiple comments that time, because they has to understand what they are doing. So this is how I have to improve my comment. So if you are putting the coins on the floor, we need to give the multiple comments, and kids also will start it too. If they are not understanding still, we also have to go in their way, we also have to collect the coins along with them. So we are doing means, they also have that happiness in their face. Okay, she is also doing with me, so this time I have to do. So like that, they we have to cooperate them with those things, and automatically that comment following will come. Lot of, always you choose to, for comment following, the interesting activities only for the kids. How to improve the logical thinking? So how to improve the logical thinking? So the major impact of logical thinking and level of understanding, it's like it's placing over all of the brain disorder only for artistic and ADHD kids. So the logical thinking, we need to see the cognitive skills first of all. For logical thinking, we need to improve the cognitive skills such as like cognitive functions, cognitive capacities, and cognitive abilities to improve their kids. So cognitive skills, they are 8 stages actually. The one first one is paying attention to the things, paying attention to the things, remembering, analyzing, processing, evaluating and judging. And logical thinking is of course is coming, and decision making and problem solving. These skills we need to go step by step to improve their logical things. How we can implement these skills to a kids means we need to choose some of the complicated and complex activities to those kids. So automatically, for example, you can see our channel also, we are uploading more videos how to improve the logical things. In the sense, you can apply those techniques to the kids. So you for logical thinking, if they are first, that major thing is you have to see the kids is giving attention or not. This is the first process. If they are not giving the attention, they won't think actually, they won't think, they won't understand also. First we need to improve the attention. This is the major most problems. If you are achieved that attention, then you can go to that like remembering. You have to give the things, activities belongs to the rememberings. After that you have to give processing, how they are processing. After that we have to see how they are analyzing. After that we need to give the activities based on decision makings and problem solvings as well. How to stop stemming behavioral or impulsiveness. As if before I told about the stemming and stereotypical behavioral and impulsiveness also. So moreoverly, how to control the impulsive behavior, in the sense like they will act without thinking when we talk about the ADHD. So we need to make them, we need to apply the discipline strategies actually. If the kid is lacking in the impulsive control means, we need to teach them the discipline strategies there. So like because they are not understanding what they are doing, so they will behave. As a parent, what we have to observe means, so what behavior is appropriate and inappropriate while they are in school and outside places, whatever might be, we need to see the behavior at that time. So some kids will behave inappropriately, but they don't know like actually how they are behaving. So for that we need to give the discipline strategies, we need to teach the strategies to reduce the impulsive control of a kid also. So you can make them to teach like for some parents, what they will think means like if the kid is not saying hello to anyone or some other person, they, it's not might be they are behaving rude on purpose. It's not might be they are behaving rude on purpose. If they are not like physically hitting others, and if they want to swear pool on the wall means they likes to, they likes the texture on the wall. So that's why they not wantedly doing to, I mean to make you upset, or they are not doing the wrong things wantedly. So we need to identify why they are doing like this. After that we need to teach the discipline strategies that time. So discipline strategies, we can make them to do role plays at home. You can do the role play in front of the kids, they will started to follow that also. So how they have to behave in a social situation place. And you can put the role modeling videos also, they will started to see this modeling modeling videos, and they will know the which is bad behavior and the good behavior. And you can teach the self calming techniques. I already told you now, if they are behaving, they can't able to control this self means, we need to that time we need to apply the self calming techniques only. I already told you that thing is like, try to give him water and tea and ask them to count 1 to 10. In this way we can reduce the impulsiveness for a kid also. Okay, ma'am. Hmm. Hmm. So like so as per like, for if you are feeling any difficulties that I can't able to manage my kids, so if you are feeling any difficulty means, you can don't hesitate to seek professional help. As a therapist we are here, you can come to us and you can see our videos also in the YouTube. In that, in the sense, you can see the, you can make the kids to develop a lot. And don't hesitate, first of all don't hesitate to seek professional help. And we are here to give the more techniques to the kids to shape their new behavioral also. Thank you. Oh, what happened means like I was